Introduction NDIS Funding Justification Guide. The purpose of this guide is to help clinicians, allied health professionals, and NDIS providers prepare clear, robust, and evidence-based justifications for participant funding requests under the NDIS. This guide directly aligns with NDIS functional domains and connects symptoms, functional impacts, and appropriate supports to strengthen access requests, plan reviews, and evidence submissions. It has been developed in line with best practices expected by NDIS senior planners and assessors, ensuring reports meet the standards for evidence-based decision-making. Section 1. Key Principles of NDIS Funding Justification. Functional Impact Focus. Funding is based on how disability impacts daily functioning, not just diagnosis. Reasonable and necessary. Supports must meet the NDIS, reasonable and necessary, criteria. Clear connection. Every support requested must directly link to a functional limitation. Plain English evidence. Reports must be easy for non-clinical NDIS assessors to understand. Quantify where possible. Describe frequency, severity, and level of support needed. Sustainability. Funding requests should focus on long-term benefits, capacity building, and maintaining independence where possible. Outcomes focused. Link each support request to a participant's short and long-term goals in their NDIS plan. Evidence over opinion. Ensure that all statements regarding participant limitations are supported by observed behavior, clinical assessments, or third-party reports. Section 2. Functional domains and justification prompts. This section provides prompts for connecting functional impairments to support needs in each NDIS domain. 2.1 Mobility, motor skills. Common symptoms: paranoia, anxiety, sensory sensitivity, medication side effects, e.g., lethargy, tremor, compulsions. Functional impacts: difficulty leaving home independently, unsafe to travel alone, mobility restrictions from medication side effects, reluctance to attend appointments, education, or employment settings. Support justifications: personal support for travel assistance, transport provision, e.g., taxi, community transport funding, aids and equipment, e.g., walking frames, scooters, community access support to rebuild travel confident, occupational therapy assessments to recommend assistive technology solutions. 2.2 Communication. Common symptoms: delusional thinking, hallucinations, cognitive difficulties, social cognition deficits. Functional impacts: difficulty understanding directions or conversations, problems communicating needs and making appointments, misinterpretation of verbal and non-verbal cues. Support justifications: personal support to attend appointments and interpret information, assistive communication devices, speech pathology or skill development programs for communication and interaction, training for support workers in communication strategies. 2.3 Social interaction. Common symptoms: PTSD, anxiety, cognitive issues, disinhibition, aggression, irritability, mood instability. Functional impacts: difficulty forming or maintaining relationships, social isolation, behavioral issues impacting community participation, vulnerability to exploitation. Support justifications: support worker to facilitate social engagement and safety, community participation programs targeting social skills, positive behavior support, PBS. Plans where behaviors of concern are present, capacity building, group activities to support development of social skills. 2.4 Learning. Common symptoms: cognitive impairments, planning, memory, attention deficits, side effects like lethargy. Functional impacts: inability to maintain focus, struggles with multi-step tasks or instructions, difficulty participating in training or education. Support justifications: educational support assistance, cognitive aids such as organizational apps and reminder systems. Support workers to assist with structured skill development, specialist assessments for learning support recommendations. 2.5 Self-care. Common symptoms: cognitive impairments, amotivation, compulsions, poor self-awareness. Functional impacts: difficulty managing personal hygiene, meals, medication, safety risks, e.g., self-neglect, risky behavior, requires regular prompting or assistance. Support justifications: in-home personal care support, assistive technology, e.g., medication dispensers, automated reminders, health and wellness coaching, occupational therapy assessments for personal care aids, risk management plans where self-harm or neglect is present. 2.6 Self-management. Common symptoms: amotivation, impulsivity, poor planning, mood disturbance. Functional impacts: difficulty managing finances, household tasks, risky or impulsive decision-making, trouble keeping safe at home, unusual or disruptive public behavior. Support justifications, support coordination or psychosocial recovery coaching in home support with budgeting, life skills, and household management. Behavioral intervention supports for impulsive behavior, guardianship or administrative orders, referenced if applicable. Section 3. Building a strong NDIS report or funding request. Use these structure tips when justifying funding. State the functional domain, mobility, communication, etc. List relevant symptoms. Describe the functional impact. Specific examples from daily life, e.g., participant is unable to leave home independently without support. Identify the support required. Link the support to the participant's NDIS goals. Explain the benefit why this support helps achieve greater independence, participation, or improved quality of life. Reference evidence. Attach assessments, therapist reports, support worker observations, and any other relevant supporting documentation. Section 4. Important references. This guide is based on NDIS reasonable and necessary guidelines. Completing the access process for the NDIS. Tips for communicating about psychosocial disability, 2016. Social Security, Assessment of Work-Related Impairment for DSP. Determination 2011. NDIS Operational Guidelines and Practice Standard for full compliance. Refer to these when preparing reports or funding justifications. Section 5. Final tips for clinicians and providers. Focus on function, not just diagnosis. Link every funding request directly to impairments in daily living. Keep language clear, plain, and structured logically. Be specific. How often, how severe, what support is needed, and the expected outcome. Use examples to strengthen evidence. Assume the reader has no clinical background. Avoid technical jargon unless explained. Make sure each requested support is reasonable and necessary under the NDIS Act. Always relate supports back to enabling greater participation in the community, workforce, or education. Conclusion. Effective NDIS funding justification relies on clear, evidence-based connections between the participant's disability, functional impacts, and the supports required to enable participation in daily life. Using structured, functional language improves approval outcomes and ensures participants receive the support they need to live with greater independence, choice, and control. Best practice means ensuring that supports are tailored, evidence-backed, outcomes-focused, and directly linked to enhancing the participant's capacity and social, economic participation wherever possible.